Hi everyone, this is Dr. Stefan. I received this interesting comment on my channel. What if I inhaled an expired inhaler without realizing it was already past its expiration date? So I think the person who's asked me this question is worried that that might cause illness or problems down the line. Now, I would just have to say that sometimes with inhalers, we tend to worry quite a lot. So patients tend to worry quite a lot if they're taking them correctly, if the medication inside will cause side effects. First of all, I'd like to say that inhalers generally have a very, very low concentration of medication. And obviously, although it's not a good idea to take a medication that's past its expiration date, I don't recommend that. But if you accidentally do inhale from an old puffer, from an old inhaler, it's likely not to cause major problems, especially if that inhaler was kept under normal conditions, so under normal storage conditions. If you've been keeping it at room temperature or, as directed, it's likely not to cause any issues because, like I said, the medication doses are very, very low. And the medications inside the inhalers are usually relatively stable. They won't degrade as quickly as it's not like a cutoff date. So when the expiration date falls, it's not like the medication will suddenly become completely inactive or toxic 2 days after. So that's not really an issue. But obviously, if your inhaler has expired, I would suggest going and getting a replacement. The highest risk, I would say, would be that the medication is no longer effective after a while. So if it's been months since that inhaler has expired, I would say it's probably no longer going to be as effective as you might want. It's unlikely to be toxic. It's unlikely that one dose from an inhaler that has expired will cause major problems. But like I said, it's not a good idea to continue taking expired medication because it's probably not going to be effective. So in that case, do talk to your doctor about getting a replacement or talk to your pharmacist if you have a prescription already. But do keep track of expiration dates of your products. Normally, all medications that you buy, especially with inhalers, are usually good for a few months, at least, after you've purchased it. Otherwise, it wouldn't have been sold to you. So I would assume that it's relatively safe if you don't check every time. But maybe if you haven't taken that inhaler for years and you suddenly fish it out from a drawer or something, maybe have a look at when it expires if you need to use it. And if you do suffer with conditions such as asthma, where this can be a common occurrence, for example, you've been prescribed a Ventolin inhaler as needed, your asthma is not really bad, and potentially you've gone for a year without any inhaler, but then you've gone somewhere, you've inhaled some allergen or some irritant substance and your asthma is coming back. It might be a good idea to just check before you take your inhaler, obviously, if you've had one somewhere lingering around the house, and maybe to just get a replacement then. I would say with asthma, keep track of having an inhaler that doesn't go out of date in the next 6 months. I think that's probably a reasonable thing to do to make sure that what you're having around the house is still in date. Hopefully that was helpful. I'm not sure. I think I've been a little bit all over the place with this explanation, but I would say, just to conclude, don't worry too much if you've accidentally taken a dose of an inhaler that's out of date. It's probably not going to cause too much problem, but I would say do look for a replacement as soon as possible because that's probably the sensible thing to do. And if you have any issues with your breathing, discuss with your doctor, especially if the treatments you are on aren't helping. Hope that was all right and helpful for you, and I'll see you in future videos. All the best.